Good afternoon, and thank you so much for joining us here on 9 News Plus. I'm Chris Bianchi, and today, as we do every Tuesday, we've got a special guest to discuss COVID-19, specifically in the Hispanic community here in Colorado. And today we're chatting with Dr. Ricardo Gonzalez Fisher, a medical expert with Servicios de la Raza. And if you have a question in either English or in Spanish for today or for future editions of this program, please email me at chris.bianchi@9news.com, and I'll make sure that it is answered. Doctor, close to 20 to 25,000 expired or vaccines that simply don't work have been given out. People have been receiving text messages. Should that concern us? What do we know about that?
Yes, some of the vaccines were not properly expired, but there was a breach in the cold chain of the vaccine. They come from the manufacturer in a frozen condition, and they have certain shelf life in the fridges, and some of them were given after that shelf life. If we count 20,000 out of the millions of vaccines that have been applied in Colorado, it's not a big amount. But if you're the person who receives that text message from the state saying that you got a vaccine that wasn't properly administered, it must be very frustrating. I would like to see this from a different point of view. We've been applying millions of vaccines in the state, in all the state, in different areas, in different clinics, in different places. And we realize that each one of those has been strictly monitored. We don't have that happening with any other medical drug or vaccine. So now we know exactly which person, which place, which state they got these vaccines that were not properly handled. So it must be frustrating for the person, but this shows a high quality of our pharmacologic vigilance, that this system is working.
So it shows the system is working. But with that said, what should you do if this does happen to you or somebody you know?
Yes, unfortunately, a lot of people are going to receive a message like this. I mean, one is too much, but they're going to receive this message. They're going to feel frustrated. But in reality, the CDCs have a strict protocol for this. This has been seen even before the massive application of vaccines happen. If this happened, what should you do? You should go to your primary care provider, to your pharmacy, to a vaccine clinic, and get vaccinated again. Those are going to be removed from the register so you can have a space to get your vaccine again.
Thank you for that. And Doctor, a more broad general question, where do you feel we are with COVID right now heading into the fall and the winter?
Yes, it's sad to look into this, but if we look at what's going on in Europe, the number of cases have been growing, multiplied by 3. And the number of people who are in the hospital has duplicated. So now, if we see what's going on in Europe as our best monitor, we will be suffering the same things maybe in 6 or 8 weeks happening here in the United States. The number of cases are going to rise. And in this case, I cannot put enough emphasis on letting people and reminding people that they should try to social distance, use your sanitizer as much as you can, use a face mask when you're going to a place where there's people, where it's enclosed and there's people that you don't know. And of course, if you haven't been vaccinated, get your vaccine or get boosted.
Speaking of that, can you tell us more about vaccine clinics, drives that Servicios de la Raza is organizing, please?
Yes, we're starting our vaccine clinics on Thursdays. It used to be on Tuesdays, but the public asked us to move on closer to the weekend because some people fear of getting side effects that will not let them go to work, so they rather have them on the weekend than on a work day. So we moved our clinics to Thursdays in the afternoons from 4 to 7, 8, depending on how many people we have there. And on the 23rd, we're going to have a festival at La Raza Park. We're going to have a holistic health festival for 5 senses. And it's free, and we're going to have our mobile health unit there providing COVID-19 vaccination.
Well, a couple of great resources to get vaccinated and for holistic health as well. Doctor, thank you so much. And again, if you have either a question in English or in Spanish for Dr. Ricardo Gonzalez Fisher or any of our future guests, please feel free to email me at chris.bianchi@9news.com, and I'll make sure that question is answered. But that will do it for this week's look at COVID-19 in the Hispanic community, specifically here in the state of Colorado. Gracias a todos. Thanks to everybody. We'll see you again here next week. Thanks again, Doctor.
Thank you, Chris.